Hello, everyone, and welcome to today's webinar, Better Care, Less Friction, How Visassist is Redefining Efficiency in Healthcare. We are so excited to have you join us today as we explore how AI-driven workflow tools are transforming care coordination and helping clinical teams work smarter, not harder. I'm Meghna Valluri, Director of Product at Viz AI, and I'm thrilled you could make time to be with us today. Before we get started, just a few housekeeping notes. This webinar is being recorded, and we'll share the recording with all registrants afterwards. We welcome your questions, so please submit them at any time in the Q&A box, and we'll do our best to address as many of them as we can during the Q&A session at the end. Now let's get started. I am so excited to introduce you to our featured speakers joining us today, leaders who are driving innovation at the intersection of technology and healthcare efficiency. Dr. Andrew Ibrahim is the George D. Zudima Professor at the University of Michigan, where he practices as a general surgeon. He has authored more than 200 scientific publications, and his work has appeared in leading journals, including the Journal of American Medical Association, Health Affairs, and the New England Journal of Medicine Catalyst. And he has delivered invited lectures across 5 continents. Furthermore, he most recently was invited to testify in Congress on AI regulation and reimbursement. He's recently been appointed Viz AI's new Chief Clinical Officer. Dr. Ibrahim is joined by Chelsea Summerhour, a neuro nurse by training and the Associate Director of Product for Neuro at Viz AI. Chelsea leads the company's neurovascular portfolio, bringing her frontline clinical experience to the development of AI solutions that support care teams and streamline workflows. Her work focuses on creating technology that truly meets the needs of clinicians and improves patient care across Viz's network of more than 1,800 hospitals. Andrew and Chelsea, thank you so much for being here today. And with that, I will pass it over to Andrew to get us started.
Awesome. Thanks, Meghna, for the opportunity. I'm live here at Becker's CEO and CFO Forum, which is just a great opportunity to connect with a lot of my peers and a lot of leaders who are facing all the same challenges. Many of you may know Viz. I see a lot of familiar faces. A couple of people I went to med school with on the call, which is great. The #1 AI-rated platform trusted by over 1,800 hospitals across the United States and many of our life science partners to really bring the best tools of AI right into your clinical workflow. I've gotten the chance to meet many of our clients and many health systems who've been engaging in our work, and the same 4 themes come up over and over, both from the clinicians on the front line of care, as well as the administrators. The first is workforce shortages. Almost every team I've met says, gosh, I wish we could have more hands on deck. There's more work to do, and I just don't have enough time to get it all done. And every administrator I talk to says, I just don't know if we have it in the budget to hire more people. Like, it's just becoming difficult. We got to do more with what we have. The second is information overload. I know this is true for my clinic. Just to start my clinic, I log into 3 or 4 places just to find the information I need for the first patient. It's incredibly frustrating to just have to get through these initial hurdles. And frankly, we've gotten so normalized to it that some of us just do it instinctively, even if we don't need those other logins. It's just become part of our workflow to spend time logging into multiple places. And when I tell the administrators that, they're saying, you're kidding me. We thought you guys wanted that extra vendor. You wanted that extra thing. And now it's creating like another barrier for you. There's tons of mismatched effort. I will say for all of the shortcomings in our health system now, effort is not the rate limiter. Everyone's working incredibly hard. And I know in my clinic, it's full of patients and I'm trying to see as many as I can, but not everybody there are people I can help. And sometimes it's a letdown. I'm going through seeing them and I'm not actually the right doctor for them to see, or I don't have something to offer them. And when I tell that to the administrators, they say, but we're still losing patients to our competitors. So you need to see more people. And then finally, documentation. There's no shortage of anecdotes around this, but probably my favorite is just getting paged in the middle of the night from a clinical documentation specialist who, very well-meaning, just wanted me to add a couple more comments to my note from clinic earlier that day. And I thought, gosh, of all the things to get paged about, that's probably like the most annoying and frustrating. So these pain points are felt almost by every health system, every clinical provider I talk to and every administrator, and certainly here at Becker's, these four come up all the time amongst the CEOs and so many sidebars, trading notes on just how to tackle even part of one and how meaningful that would be. And I'm excited that Viz has put together a product that I think touches all four, and importantly gets clinicians and administrators on the same side of the equation. We call it Viz Assist. I know many of you have already read the New England Journal AI article that Chris Mancy and I wrote a couple weeks ago. But imagine you just have this full-time assistant with you who never sleeps, doesn't miss a beat, and helps you get through your work. The first part of it is a chart summarization, going through those hundreds of pages, the 4 different logins, and just finding those 4 or 5 things you need to be able to go see that patient and make a decision. That's the first step. The second is, gosh, how fast do these guidelines change? Like, I sort of feel humbled that I've already become a board certified surgeon, but if I had to go back to my boards now, I mean, there's some sections that'd be really hard to pass because the guidelines have changed so much just in the last couple of years. But wouldn't it be great if right alongside the chart summarization as a tailored specific guideline that had surfaced to let you know what to do? Walk down the hallway, go see that patient, record that conversation with an ambient listening tool, records you, records them, summarizes it, puts that into a note. And not only is it a note that's written in the format that you need it, it also includes billing and documentation things to avoid that page in the middle of the night to add that one more detail. So all these agents can work together in a single platform, and it's Viz Assist. And I think better than just telling you about it, it'd be great to just show you.
I've opened up the aneurysm suspected list within Viz Assist by clicking on the disease state on the left-hand side. You can see that there's already a case here, and when I select patient Eliza Burke, the patient details screen will open on the right-hand side. Now, imaging AI is probably what you think of first when you think about Viz, and that's still very much part of the picture. Viz will continue to flag suspected disease states and provide automated measurements from imaging, ECGs, or whatever clinical area you're focused in. What's new is that Viz Assist can now layer in clinical insights from the EHR on top, which gives you the context you need to make more informed decisions. So after reviewing this CTA, I can see pretty clearly that there's a sizable unruptured aneurysm in the right ICA. The ED provider at a spoke hospital already sent a consult to me, so let's toggle over to the Viz Assist tab. This is what really differentiates Viz Assist from other summarization tools. As Andrew mentioned, Viz Assist is disease state specific. Because this is an aneurysm case, the summary focuses on exactly what I need to determine the next best step for this patient. I can get aneurysm size, location, rupture risk factors, prior imaging, and plan of care. And at the top, I have access to the clinical practice guidelines. Now, if I'm a neurospecialist, I may not need to toggle into this right away. But if I'm an ED provider at a spoke hospital, I would want to know that this patient probably needs a neurosurgery consult or an NIR consult to figure out what the appropriate treatment pathway is for this patient. As I scroll down, the summary will tell me that this patient presented with a suspected TIA. They have a 4 mm saccular aneurysm. They're neurologically intact, and the ED provider has already placed that consult that we talked about. I can see the treatment team that's attached to this case. Dr. David Stern, and this demo is me. And then I also have the ED physician and the patient's primary care provider. So there's not another neurosurgeon attached. There are no other neurospecialists attached. So I can make a pretty clear assumption that this patient isn't being followed for their aneurysm already. And if you look at the summary, and I want to know where Viz Assist is pulling some of this information from, all I have to do is click into one of the citations, and I can see exactly the point in the EHR where we're getting that information. As I scroll down, I can review the plan on file, the patient's code status, a really focused history. So I'm not going to tell you that the patient broke their arm 10 years ago or that they had an appendectomy when they were 12. We're again going to focus in on family history of aneurysm or subarachnoid hemorrhage, if they're smokers, if they have hypertension, things that would really raise a flag for me that I need to see this patient more quickly because they're at a higher risk of rupture. I'll also get a really concise medication list. And one of my favorite features is that we do a detailed breakdown of the radiology findings within the chart. So I'll know the type of aneurysm, the location, size, morphology, and we'll also call out if there's been any change from previous imaging. So under that growth line, I'll be able to tell you if that aneurysm had been identified previously and if it's gotten bigger or changed morphology over time. One of our early users actually had a patient whose aneurysm was first seen almost 10 years ago and ended up in a radiology report, but they never had any follow-up. The patient presented again for imaging recently. Viz flagged the aneurysm on the CTA, and then Viz Assist was able to surface that historic finding and show that there was really significant growth over the years. And now that patient is in clinic, getting the appropriate follow-up, and that's really the power of the solution. We're not missing patients. We're turning the information into action. And as a nurse, that brings me so much joy to be able to share with you all. Okay, so back to the summary. The last section will be really focused lab results. For aneurysm, we're just going to give you the coag panels and the renal function in case this were a more urgent patient that needed to get into treatment a bit faster. So now I have a really clear picture of what's going on with this patient. I'm going to go over to the HIPAA compliant chat. I'm going to thank the ED provider for flagging this patient to me, confirm that there is an aneurysm and they're okay for outpatient follow-up. And then I'm going to move on to letting my team know that this patient needs to be scheduled, which I can also do within Viz. By clicking the refer button, I can select NeuroClinic and send a message to my scheduler or my APP, whoever's helping to ensure that these patients are seen and don't leak out of the system. When I send the referral, it will send a notification to the other user, and I have the best clinic in the world, and they get this patient scheduled for exactly 6 weeks from today. On that day, I can open up my NeuroClinic list, open up the same patient, and I haven't looked at this patient in 6 weeks, so I definitely want a little bit of a refresher on why they're coming to see me today. So I'm going to open up the Viz Assist tab, scroll down to the summary, and I can see very clearly that they're here to talk about treatment options for a 4mm aneurysm. I can also dig a bit more deeply into the summary if I want more information, but I don't have to go to 50 different places or log into 5 different systems like Andrew was saying to understand what's going to be the topic of conversation for this outpatient visit. Again, at early pilot sites, this sounds like a really simple workflow improvement, but we've seen pre-charting times go down from about 20 to 30 minutes to about 4 minutes per patient in a lot of cases. So that's a really significant workflow improvement. Now, when Eliza shows up in my clinic, I can just click on the blue microphone button to launch Viz Assist's ambient listening tool. Now, I can set down the keyboard, look her in the eye, and just have a conversation about why she's coming to see me today. We can talk through risk factors, treatment options, really focus in on her questions and concerns. And as you can imagine, in a lot of these situations, patients are really scared. We're talking about something abnormal going on in their brain, and it means the world to them to have your full attention. But again, as Andrew mentioned, ambient listening isn't just for patient conversations within our platform. It could be used anywhere you need to document naturally. You could record a quick consult note. You could capture a procedure note right after a thrombectomy. It's designed to work across care pathways and just make documentation easier, whether you're in the ED, the angio suite, or the clinic. So when I click stop recording, it will pre-populate a templated note for you. Each section is fully editable, so I can go in and change anything I want. I can rename the note. If I scroll down to the bottom, I'll see some billing coaching, so there'll be suggested codes. If there's anything that I don't agree with, I can get rid of it. And then with our integrations, we're able to either just copy the note and paste it into the record, or we can set up an actual push into the EHR where you review the note, clear it, and send it to the EHR to be signed. So while I've been focusing on the aneurysm example here, what's really exciting is that Viz Assist applies the same disease-specific intelligence across all of our modules. In LVO, for example, if I open up the summary, you'll see things like time last known well, treatment windows, perfusion details. For ICH, we can compare patient details against guidelines or protocols. So we could set up something to identify if someone met enriched protocol criteria and might be a good candidate for minimally invasive evacuation. The applications are really endless, and they all live inside of one consistent Viz experience. So just to recap, Visassist provides disease-specific summaries, surfacing what clinicians need to make the next best decision for that patient. It enables collaboration, reduces chart chasing, captures documentation automatically in any setting, and it just helps make clinicians faster and inform their decisions. It supports administrators with better documentation and workflow efficiency, and it can give executives more scalable ROI impact across the VizOne platform. So this is Visassist, and I really don't think I've ever been more excited to share something that we've built. And I think now we're handing it back to Meghana for Q&A.
Chelsea, thank you so much for that detailed walkthrough of Visassist, and especially making it real and tangible with the aneurysm example. I think that is just so illuminating. And we are, I think, all so proud of this product. I would love to know and take questions from the audience now. So if folks could please share any questions in the Q&A box. I'll give everybody about a minute. We have some coming in already.
I'll just make a couple comments while we have questions coming up. When I was like sitting at home looking through this and trying to explain to my wife what this was, she's not in medicine. And she said, so does this mean on Monday nights, instead of pre-charting for your clinic on Tuesday, you can just have dinner with the family? And I was like, yeah. I mean, the 2 hours that I spend looking up every patient, 20 minutes each patient, looking for this detail, even just the searchability to say, okay, I just want to know where that operative note is. Give me that summary so I can click on that link just to go to that thing. That's like the only thing I want to know. Once I know that, I know I can go see that patient. It just saves an enormous amount of time. So then I can just go to clinic and focus on being a doctor and not worry about all the other stuff around it. So I'd say like for me personally, that's been like such a joy to know like, gosh, that future is like now that we get to just be doctors and everything else gets taken care of for us.
That's amazing to hear. And it makes it so tangible, just the impact of it on just individual people's lives. We do have some questions coming in, so I want us to make sure that we can get to them. First question is around the summary and the Viz data and how we are integrated with the EHR. So there's a question about whether we obviously are ingesting data from the EHR, but Chelsea, are we able to also push data back into the EHR?
Yes, so we can do a bidirectional integration. That's a big part of what makes Visassist so valuable is we can pull the information in, and then you don't have to push 50 different buttons to get that information back into the EHR. We want to reduce the clicks and reduce the duplicative work.
That's awesome, and that's so great to hear. Another follow-up question was around which EMRs does this integrate with? I can actually take this one. So we have broad integrations with all of the leading EMR vendors. And so we have experience doing ones with Epic, Cerner, Athena, ECW, Meditech, and more. And we're continuously growing our list. So we're very flexible with whatever your hospital system uses, and we're willing to work with you on making sure that the integration is as seamless as possible. We do a lot of these, so it's in our bread and butter capabilities.
You know, what's amazing about that point, Magna, that I just kind of want to like point out.
Yeah.
The EMR was never designed to document things for patients. It was designed for billing. And so it's become this like amalgamation of all this information that you kind of like don't want.
Yeah.
And it's not hard to envision now with VisAssist where basically just with your phone, you can do all the things you need to do to see a patient. You can see their imaging, you can see their relevant labs, you can document things you need for your note, and that all get pushed to the EMR. Like you could almost run your whole clinic almost without being in the EMR, besides maybe proofreading your note or something, or looking up something that was too small on your phone or whatever. But it almost like gets you beyond like besides the point of the EHR, which I think is like the goal of so many doctors. Like just give me the information to do the work and don't
Yeah.
let me get stuck in the rabbit hole of the EHR. So it's like easy to start to envision that reality now.
Yeah, it's incredible. The technology has gotten so good. And we, of course, were the pioneers in imaging AI. We started there when that was what, was novel. And now we just think about this as like a new layer to our platform, and are jumping into that realm of generative AI.
The tech getting so good, just one sec. One of the things that I love is that we can also pull data from PDFs that are attached to the EHR. So it's not just structured data. I know that when I was working in a quality role, it was awful to have to manually go through each of the PDFs to try to pull out the relevant information. It would take me sometimes hours on some patients, and now physicists can just do it for you. And I wish I had that tool when I was doing all of those investigations.
That's amazing. Okay, we have another question from the audience. Can Physicist or Viz also integrate and ingest any type of imaging, including, I believe this person is interested in MRIs. So Chelsea, that one's for you.
Yeah, so we can display any type of imaging. And in terms of ingesting the information from the EHR, we would be agnostic. So we can pull in a radiology report from an MRI, from a PET scan, obviously from CT imaging, and provide that information back to the patient. So we're able to give all of the details from any sort of imaging back into the patient summary.
That's so great. It's like a one-stop shop for everything. Yeah. Another question that we have from the audience is, what is some of the real world evidence looking like from early adopting institutions and hospital systems? Andrew?
I love this. I mean, I got a text message from a friend someone I knew from med school who I didn't even know was using Viz and saw that I'd joined Viz and unsolicited told me that his chart review's gone from about 40 minutes down to like under 10 minutes, which is just like enormous because he's a busy clinician and sees tons of patients. And so I think the time saving has been documented very well. We have a number of abstracts coming out later this year at a number of the national meetings where multiple sites now are going to share their experience that essentially show the same thing.
I'm so excited about the evidence that's coming out from these sites. I feel like it's even better than we hoped it would be, and we had big hopes for it. And so stay tuned for, I think, a lot of publications to come and abstracts to come. Okay, another question we have from the audience is around guidelines. How does Viz incorporate guidelines into our products? Chelsea, perhaps you'd like to take this one and let me know if I can jump in.
So we can do it in a few different ways. We can provide access to guidelines, which is probably the most basic way that we can integrate. So just you have it as a resource within Viz. We can also create suggestions based on those guidelines. So we would compare the information in the patient chart and through the AI findings to the guidelines to identify gaps in care or suggested next steps, considerations. So for example, if you have a patient with a brain bleed and they're on an anticoagulant and that hasn't been held, we would be able to flag that. And you could incorporate that into your workflow to ensure that we're not missing those red flags.
That's awesome. Okay, for Andrew, does this—
Can I tackle the cost question? Is that the one you're going to give me?
Yeah.
No.
No, it's great. And I think it's important, how much does this cost? And I want to say like a few principles that are really important to me and like to really all of us at Viz. First of all, so we want it to be valuable to you. So for your first 1,000 encounters and 20 users, it'll be a free add-on to your Viz account. And so you can just use it, try it, see how it works for you. And our second principle is we don't want you to pay for more than you're using. So in that first trial period, we'll estimate what your usage is going to be, and then we'll set up your contract just based on that usage. So if you use it minimally, just a half day a week in that one clinic, we'll set up your annual budget to be at that rate. If it's used in every clinic 5 times a day, awesome, we'll estimate it that way. So We want you to try it first. We want you to love it. And then we only really want you to pay for however you are using it in your groups. And so you're not getting any surprise bills. You kind of know what you're getting.
Thank you, Andrew. Okay, Chelsea. So for hospitals or systems evaluating this, how does the clinical team and the implementation team help overcome some of the challenges and things that come up in implementing the system? I know you have been really close to deploying solutions that Viz has within hospital systems.
I actually think this is one of the things that Viz has done a really good job at prior to Assist, and one of the things we're going to continue to excel at with Assist. We have incredible people on our implementation team, on our customer success team, our clinical team, and our product team is pretty cool too. But we are all available to help with the initial implementation, help you define what success would look like for any sort of evaluation, and help you figure out the best way to measure that success. So depending on what pathway you're looking at, we have people who have worked there clinically, who have worked on the product, and who know the technical steps to get this implemented. So you will not be doing this alone, and nothing brings those teams more joy than seeing a successful implementation and evaluation. So we'd love to work with you.
Yeah, I think it's awesome. I've been lucky to be close to some of these as well. And I think the Viz team is willing to move as fast as the hospital system is. And because we want it in your hands and we want to see everyone use it. Okay, probably our last question for today. Does this only work on some of the existing Viz algorithms or modules that we have today, or is this applicable more broadly? Andrew.
Gosh, this gives me so much joy. I mean, literally just about an hour ago, I was piloting our Viz Assist in areas that we've never even touched as a company, like things that are in my home clinical practice, abdominal wall reconstruction, redo appendiceal masses, and already just our default ability to do it is like 95% there. So with just a few tweaks, probably in the next quarter or so, we'll be able to roll this out to much broader conditions. So I would say like, neuro's kind of always been our home base and home, and it's the most logical place to start. Cardiology, pulmonology, and oncology are already very close. And it wouldn't surprise me if in the next year we have it generalizable to the entire platform of your hospital. So I'm super stoked. When I joined Viz, it was one of the first things I asked, and the timeline for it just keeps improving every time I ask a follow-up question. So I'm thrilled to see that come to life.
That's awesome. I think we are all, myself included, super excited for the growth ahead and to see this technology really change the way clinicians operate in these health systems. I think I speak for all of us when I say that we mostly want to let clinicians get back to doing what they got into this business to do, which is see and treat patients and take away all of the additional clutter that's taking up their time. So that's our North Star, and we're so excited about the progress so far and everything coming up. Andrew and Chelsea, thank you so much for your time today. You both are amazing and such subject matter experts. Thank you.
Thank you, Meghna. Thank you, Chelsea. Thank you, everyone.